Okay.
Lisa counts. Okay guys, thanks for sitting and listening to me. I'm going to give you a demonstration on how to give an injection. I do these a lot at work, but it's becoming more common for people to do them at home, like I have to do for my spouse a couple times a month. And so just going to go over how to give an injection. You're going to get your supplies together, medication, make sure you have it, it's not expired, it has a little rubber stopper on the top which you got to stick the needle through. What I like to do whenever I'm setting mine up is swab it with an alcohol pad, let it air dry on top of the stopper while I'm trying to figure out where I'm going to stick the needle in on him while he's crying. And then I start getting my supplies ready, and these vials are a vacuum seal vial, so you have to displace it with an equal amount of air. So you're going to draw back the plunger on the syringe with one needle to the amount of medication you're going to displace. This should be clean, so you're going to uncap the needle, go in at a 90-degree angle, depress the plunger to displace the air, invert the vial, draw out the same amount of medication that you just displaced with air, re-tip the bottle, pull it out. And then you should have your medication in here that you're going to give. You'll switch this needle out so that you don't use a dull needle on someone's skin, because they don't like that, and it goes in a lot slower. You will then put a new needle on that you're going to use to inject the medication. When you do that, you're going to kind of flick the needle just a little bit and then push the plunger up until you see a bead of the medication at the top of the needle. That lets you know that everything's full and there's no air in there. And then you kind of set that aside, and you're going to get your muscle then that you're going to go into. These are usually given intramuscularly, either in the arm, the outer thigh, or the bottom, are the most common places. So you'll swab the skin. After you locate the muscle, you'll swab the skin with an alcohol pad, let it air dry, make sure that your needle's ready. Then you can uncap the needle, and you're going to hold the skin taut over the muscle, and you're going to go in directly at a 90-degree angle. It's kind of like flicking a dart. The faster you go, the better. Hurts less. That's why you use the sharp needle. You're going to pull back slightly on the plunger to make sure there's no blood that comes back into the syringe, which would indicate that you have hit some sort of blood vessel. As long as you don't get any blood back in the syringe, you can go ahead and depress the plunger all the way down, and that puts the medication down into the muscle. And then you pull directly straight back out and apply a little bit of pressure and a bandage over the site. If you do happen to get blood in the syringe, you're going to take the needle out, dispose of that needle, start the whole process all over again because you've contaminated it. So at that point, you can comfort whoever it is that you have just given an injection to. In my case, I have to do a lot of that, and some people may not, but I do. Other than that, it's pretty easy, straightforward process, and hopefully now you have a little bit better idea of how to do that. Thanks.